Crystal, we're ready.
All right. Hello and welcome to HCCI's Annual General Meeting. My name is Crystal Mark and I am the chair of the board. My pronouns are she and her, and I'd like to open this up with the land acknowledgement. City of Hamilton sits on the traditional territory of our Indigenous brothers and sisters of the Huron-Wendat, Anishinaabeg, Haudenosaunee, and Mississaugas, and we are all bound therein to honor the Dish with One Spoon Wampum Agreement. And whether we identify as First Nations, settlers, or those brought to this nation by force through transatlantic slave trade, colonialism, or refuge from war. Today, let us give thanks, Miigwech, for our courage to gather here in spirit and in body and to face another day. Let us give thanks for the plant life and creatures of the land, air, and sea that gave so that we may be sustained for yet another day. May we also give thanks for this space to build camaraderie and revolution. Chimigwech, Chimigwech, Ashe, Aho, all my relations. So again, I'm Crystal Mark, and I am the current chair of the board for HCCI. This post has been my honor for almost 2 years now, and it allows me to support people and the work that allows Hamilton to thrive. I venture to say that there's not another organization in this city and quite possibly the GTHA that moves and shakes, decolonizes and rebuilds like HCCI. During this multi-layered pandemic where illness, isolation, ableism, racism, homophobia, and transphobia have all been on full display, this organization has responded with courage, tenacity, and dare I say, love. Caremongering became a verb of substance under our watch. People sought this agency out to give of their private funds to make public change and public impact. We heard We heard numerous stories about how our organization amplified people's own sense of agency. And we consulted, we educated, picketed, and supported Hamiltonians in their time of need. It was our duty and our right to do so. I don't believe there is a movement in this city that we haven't touched. Our staff is incredible. Whenever I think of the responsibility I have to steward as chair, I really actually think about how easy it is to do because of the multifaceted, highly diverse, and exceptionally talented people, some of who haven't even reached 30. That shows you how where I'm at my age, who go on to save the world over and over again with their daily work and activist resistance. We are a survive and thrive group here at HCCI, and we are here to stay. And with that, I want to welcome donor memberships. Thank you for fundraising gifts and assure you that your resources are stewarded safely, fairly, and equitably. I would like to thank you for your presence here tonight and your commitment long after this call is over. I'd like to thank our new slate of board members and welcome them, while I simultaneously give thanks for our current board and bid a sad farewell, but not goodbye, to our members who are stepping down. You, each and every one of you, is Hamilton. We are a mobilizing, roll up your sleeves, ally building, anti oppression, decolonizing force to be reckoned with. And HCCI is honored to do this sacred work with you. Thank you for your continued support, in courage, and in solidarity. Ashe. Kojo.
Uh, thank thank you, Crystal, for setting the stage, and thank you to everyone that has tuned in. We just shared um, the annual report in the chat, so you can have access to it. It's been a very busy day for us, so we couldn't put it up on our website, but trust us, it will be up on our website tomorrow. However, we've been able to put the whole report on the in the link, and we put a couple of snapshots on our Twitter account earlier on this afternoon. So I'm just going to give you a broad overview of some of the things that we did during the pandemic. And as Crystal Mark, our chair, referenced, it started off with caremongering Hamilton, and caremongering was started by the Disability Justice Network of Ontario, the Hamilton Students Mobilization Network, and Eric's Cupboard. At the height of the pandemic, they got together, they purchased food. The community came together, as Crystal said, with lots of donations and food. Other supplies were delivered to immunocompromised folks, folks that were struggling to get food. And I must say, DJNO and all his partners were able to support over 10,000 families here in Hamilton. It addressed the issues around food insecurity. They built a community of care, and really, that was the beginning of understanding and talking about the deep inequalities that we see in our city that existed even prior to the pandemic. So a big shout out to the folks at DJNO, Hamilton Student Mobilization Network, and Eric's Cupboard, a movement that was started by racialized youth, queer, trans folk here in Hamilton. As we all know, the pandemic really shifted and changed the trajectory of everyone in the country. The federal government realized that they had to provide supports to non-for-profit organizations and charities that were working with marginalized and vulnerable populations. So we were able to get some funding through the Emergency Community Support Fund, and with that funding, we supported 413 Black families and students with peer to peer supports, school supplies, food supplies, and mental health connections. Most of the 413 families that we connected with lived in the L8R, L8L, L8N, and L8K postal codes, or as the public health folks will say, FSAs. While most of the families lived downtown, the support we provided was across the city from wards 1, 2, 3, 4, 5, 7, 9, 13, and 14. So our work again moves beyond the downtown core. So we thank the federal government and the Black Advancement movement in Toronto that talked to the federal government about the importance of supporting Black families and other marginalized communities. COVID, well, March 2020, that's when everything shut down. um, HCCI, Dr. Ameil Joseph, and a number of health experts, petitioned the Emergency Operation Center and Public Health to start collecting social, demographic, and race-based data. And eventually, they did that, and the numbers were not surprising, but were stark and a reminder of the embedded structural inequities that we see. So I think moving forward, as we talk about public health, social determinants of health, we really have to be in tune with what is going on in our communities and how we're going to respond to those inequities, because obviously what we've been doing prior to the pandemic has not been working. Our Black Youth Mentorship Program, which has been one of our core uh, um, our core programs obviously had to take a huge transition process. Schools were closed. When schools were open, there was a period where everything was done virtually. So our numbers definitely did go down, because prior to the pandemic, we were in schools meeting with students and having conversations with them during the sessions, and due to virtual school, that was limited. So with the group sessions that we held at Benny Custis and McNabb, there were 4 sessions, and we had 27 students participate in those sessions. With our one-to-one mentoring our program, that also took a huge change, because we had to, prior to the pandemic, we were pairing mentors with mentees, and since people couldn't meet, we had no vaccines in sight. We had to do these online. So thanks to Chance, who is our coordinator, decided to come up with what he called the spotlight mentorship sessions. So we would have a mentor come in. It will be live streamed, but there would be a private session with Black students, where Black students could ask questions about things that they were interested in, and then we'll do the live stream so that any Black students and all students could have access to some of the information that was shared. So you can find that on our Facebook and our YouTube page. So we did 3 sessions, and we had 7 constant participants attend these 3 sessions. Um, we also had a Hamilton Civic Leadership Program that was geared to Black, Indigenous, and racialized youth. We had about 20 youth participate, and the sessions were around being involved in their community, how to be engaged, how to work with community, and to understand the different levels of government, and how to interact with the different levels. Talk about policy changes. So that was a good program that ended this year. We're trying to figure out ways to continue the program even though the funding is over. One of the other key things that we did in 2020 was to work with the city and other community organizations to draft the community safety and well-being plan for Hamilton. And I think this plan is a very, very important plan that has been mandated by the province, that allows for a reframing of how we talk about community safety and the well-being of residents, not only here in Hamilton but in the province in general. The plan is focused on social development, prevention, risk intervention, and incident response. So the 6 priorities that we all agreed needs immediate attention were hate incidents, issues around violence, mental health and stigma, substance abuse, housing and homelessness, and access to income. So I think in the coming months and years, we'll figure out how to uh, uh, um, use the plan to address some of the things that we are seeing in Hamilton. We also did some prior work around developing an online platform for reporting hate. We continue to do that work with the help of Dr. Ameil Joseph and some groups at McMaster. So we'll continue to do that work in the coming months and years. And we also released uh, the Just Recovery policy documents that contained over 150 recommendations for the city of Hamilton to look into, to ensure that, as we are living and addressing the issues of COVID. We're making sure that nobody is left behind. The last thing that I wanted to add was we were supposed to have an anti-racism conference during March of 2020, and obviously because of the pandemic, it didn't happen. So we had to do it later on in the year, and it was a huge undertaking because we had to do it online. And in doing it online, though, really did push us to try different things and to figure out ways to connect to community. So we had a number of sessions that featured member of provincial parliament Laura Melindo, author and activist Desmond Cole, Dr. Ameil Joseph, journalist Pasanth Mata and Nam Kiwanuka, and academics such as Lin Lee, Huda Hassan, and indigenous health expert Yorogalo Jonathan. And we partnered with the Hamilton Immigration Partnership Council, the Ontario Council of Agencies Serving Immigrants, the Sexual Assault Center, Hamilton and Area, RABO, the YWCA, to provide this conference to not only Hamiltonians but Canada in general. And so we had to live stream all of these sessions, and collectively we had over 27,936 views on our social media platforms. So the work continues. We continue to work with various community groups. We continue to provide mentorship for up and coming groups. We're working with the Hamilton Community Benefits Network, with the Disability Justice Network of Ontario, with Rafiki Hamilton, and the youth group Never Gonna Stop. So these are the things that we did throughout the year. Some of them we continue to work on it, and we hope you join us to engage in that work, because it takes a lot of commitment, a lot of work, and a lot of relation building and changing some of the thought patterns that we have with respect to what community engagement and civic inclusion looks like. So that is it, and you can read the full annual report on the link that we sent out. And I think, Crystal, that's it for me.
Thank you so much, Kojo. Next, we have our treasurer's report. I'd like to introduce you to Amy Manjani. Amy, the floor is yours.
Hi everyone, my name is Amy. I have been honored to be HCCI's treasurer for, it feels like yesterday, but it isn't. So I would like, first of all, to thank our previous bookkeeper, Lucy. Thank you for the work that you've done for HCCI. I would also like to thank our current financial coordinator, Zoe Chen. I think I have her name correct, for just propelling this organization to a place where we feel there's a consistency in our reporting and in HCCI's finances. So part of what I'll be reporting today, all due thanks and effort go towards Kojo and Zoe for giving the necessary information that the auditors needed to prepare the financial statements. It will just be a very brief overview, but if any of the members or the board members in general would like to have further insight on the financial statements, I am available at any time. So I will start, mindful that some of us do not have not financial literacy. That sounds terrible, but I'll not make it as complicated. So I'll start with the statement of financial position. So it's a marked improvement from 2019, where our assets were at 58,277, and at the end of the fiscal year 2020-2021, we were at 288,001, which is also attributed to the fact that we have more programs and more funders and also more donations. So thank you. But that's not here. So and then compared to liabilities, because we have more programs as well and we're spending more, at the end of this fiscal year, we were at 285,000, I believe. I hope I have those numbers correctly. And 2019, we had less programs as well, so it was at 47,393. But in general, we have a net positive position. So we are at our net assets are at 2,146 compared to 2019, which was a loss, was negative at 17,000, around 17,000. So thank you to Kojo and members of the board for bringing us to a good place. All right. I will go to the income statement. If there are any questions, if I'm going too fast, just let me know. So the income statements basically are just a review of our revenues and expenditures for this fiscal year. So in 2020, as I mentioned before, we had more programs and we had more funding coming in. We were at 532,477 compared to 2019, where we just had around 312,000. Our expenditures for 2020 obviously were higher, at 513,267, and in 2019, they were at 328,000 approximately. Again, our loss, profit, and income statement is a profit loss statement as well. So our loss for 2019 was 17,000 again, but at 2019 we had no loss, we had a surplus. So also mindful of the fact that one of the things that the auditors pointed out that COVID has made it particularly not challenging, but it requires a different eye in reviewing our financial statements, because for some of the funding, for example, to the ministry, weren't fully spent. So that might show a change in how our cash flow or in the amount or how in debt, well, not debt, but anyway. So I hope I'm making sense. I'm talking too fast. But yeah, so that might show some changes in our financial statements compared to last year. So keep that in mind. What I would present as a priority for the board just reviewing the financial statements is, if we look at our assets, our net assets, basically a statement of, if we look at our net assets, it would be assessing the liquidity position of the organization and where we would want to be. So that could be a priority for the board going forward, in addition to the push for more donations. But otherwise, I feel like we are in a good place, and most of the work that we've done through the board and all the effort that the board has put in shows that. And I would hate to speak on behalf of the board, but I feel like I have full confidence to say that for 2020, 2021, it's been a good foundation for HCCI, and we can explore other measures of financial control, where we want to lead this organization, and also how our spending and the programs we work on, how that would reflect the strategic mission of this organization. And I feel like this year has been an insight into what the coming years could look like. So with that, if there are any questions?
Thank you very much, Amy. That's much appreciated. We have to move forward, and I just need to have a motion to approve HCCI's audited financial statements for the 2020-2021 fiscal year. Can I have a show of hands for all who are in favor? Okay, can I have a show of hands for anyone who's opposed? All right, motion carried. Now, next is the motion to approve the minutes from the 2020 Annual General Meeting minutes. So from last year's AGM, which you received via email. Can I have a motion to approve the minutes? Motion. Thank you, Cameron. Seconded by Amy. Thank you very much. Can I have a show of hands for those who approve the motion? Wonderful. Thank you. And let's see, I think I have one more motion. Nope, two more motions. All right. Motion that the Hamilton Center for Civic Inclusion continue to retain the services of Pettinelli Mastro Luisi LLP as our auditors for the 2021-2022 fiscal year. So that is a motion to continue with the auditors that we have. Can I have a first hand for that motion? Thank you, Jamil. A seconder? Thank you, Brenda. And all in favor? Raise your hand. Thank you. All right. All opposed? Anyone? Okay. And then my next motion is to acclaim the new slate of incoming governing council members proposed by the nominations subcommittee. So we have a new committee members. Cameron, could you please just read the list of the names for me, please?
Sure thing, Crystal. Just give me one quick second to grab it on my screen here.
Okay, thank you kindly.
Yeah, the names of the new members joining are Sarah Jacob, Kusum Bada, Maddie Brockbank, Zaina Hassan, Sameh Helme, Hasnan Khan, Shirley Kyorkis, and Alicia Weingarten.
Okay, thank you very much, Cameron. So I need a mover for the motion to acclaim the slate of this incoming governing council members. Thank you, Cameron. And may I have a second? Okay, thank you, Amy. All of those in favor, please raise their hands. Anyone opposed, please raise their hand. Okay, sorry, Jamil, I thought that might be a raised hand. Okay, so it's carried. Thank you. With this, we are going to adjourn the business part of our meeting and move to some of the more fun stuff with our speakers. We have a wonderful slate of speakers that includes Dr. Ameil Joseph, Sarah Jama, Joanna, I'm sorry if I butcher this, Frketich, and one more, just one second, and Terri Bedminister. So first of all, I want to welcome all the new board members. Hooray! Thank you for joining us. And let us adjourn this meeting in a good way. And thank you, all of you, for attending. And we're going to do we're going to get into the revolution now. So let's talk. Thank you. Kojo, over to you.
Okay. Thank you. Let me see if we have our speakers. Oh, okay. There we go. Hello, Ameil.
Hello.
We're waiting for the other speakers. Just give me 1 second as I try to get it.
Hi, Dr. Ameil. How are you?
I'm good. How are you?
Good. I hope, despite the pandemic, you're doing well.
Yeah, hanging in there. Strange times.
Yeah. Yeah, to say the least, for sure.
Okay, I think oh no. All right. So while we wait, since we have Dr. Ameil Joseph here. Oh, we have Terri. Okay, great. Hello, Terri. Can, can you hear us, Terri? We can't hear you.
We can hear you now.
Okay, yes, we can
Hey,
hear you now.
you
Okay,
can't
good.
hear me?
Good. No,
Oh
we can.
boy.
We can. No, 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 no. We can hear you. Don't change anything.
Okay, great.
Okay.
There's a bit of a delay though.
Yes, that's fine. That's the world of virtual events. Okay. All right.
Let's
So,
see.
um, let me. I'm trying to get a hold of our other our other speakers. So let me do that, and then maybe while we do that, uh,
Right. Nice to
Dr.
see you,
Emil
Ameil
Joseph.
and Crystal.
Hello.
Good to
Oh,
see you as well.
okay.
Okay, I think we're just waiting for one more
We're
person.
waiting for Joanna. So while we wait for Joanna, maybe Dr. Emil Joseph, I gave it during our AGM report. I made reference to our online platform for reporting hate. So while I track Joanna down, can you give uh, the viewers and those that will watch this later an overview of why an online platform for reporting hate?
Sure. So if you bear with me for the next 3 hours or so, I can cover for you. I think I'm kidding. Briefly, uh, it's now been about two years of work from the point at which some grad students in gender studies and feminist research assisted with a kind of an initial literature review and analysis of existing online community-based, community-owned hate reporting platforms, whereby the knowledge is something that the communities that are impacted by hate and racism own. And what that does is it transforms who the knowledge can be wielded by, mobilized for, in ways that dictate what's said about communities, what's said about what's happening to them, and the ways we analyze it, as well as the ways that communities, agencies, organizations, and leaders can decide what they do with this knowledge in terms of policy advocacy or at really all levels of advocacy and governance. Um, so that initial work helped us outline what were the kinds of things people were thinking about in relation to um, something akin to the OCAP principles, so the First Nation, Métis, and Inuit data governance structure, which is trademarked around ownership, control, access, and possession of knowledge. And if we're thinking about those kinds of things ethically, then we're not thinking about the kinds of things that one institution, say police, think counts in terms of what is hate or what is racism or not. But we're then thinking more broadly. And I think that's not a foreign concept. It's widely appreciated and respected that hate occurs across systems and institutions and structures, that it happens in daily life, and the police can also be a perpetrator of such hate, and thereby can't be the conduit for reporting if they are part of the problem. And a way to divorce oneself from, a system where that is the only way you are seen, you have a way to develop a platform whereby people can access knowledge about what they can do when they experience hate or racism, and uh, have access to legal resources and uh, information about policies related to employment or healthcare or education or social services or public works. These might be things that are relevant to the Ontario Human Rights Code. It might be the kind of thing that you bring forward to consult with the Hamilton Community Legal Clinic, or through the Hamilton Anti-Racism Resource Center to garner support, or, or it might also be the kind of thing that you want to report to Hamilton Police, which is also an option that that is open. And we didn't have anything like that in the past, and it's the kind of thing that has been widely discussed and appreciated. And there are models that exist out there, and some good ones that think about these ethical considerations and the ways that we can better resource people to be agents in their own liberation, and ways that we can build capacity across community Black-led institutions and other agencies and organizations that are also highly impacted by hate and racism in Hamilton. We know Indigenous and Muslim and Jewish communities as well were 1, 2, 3, and 4 in terms of people who experienced hate, and we didn't see the levels of reporting reflected via traditional reporting mechanisms. And there's work in progress to now develop the actual platform itself. And HCCI is working with the Sherman Center for Digital Scholarship at McMaster University, and in that phase of thinking about what this interface will look like. And some of the other work affiliated with the project is thinking about how best we do that in consultation with community members, agencies, organizations, and institutions, such that we don't develop it in isolation. And it's the kind of thing that we feel like we own together. And if it doesn't work for us, then it has to change.
Mm-hmm. Great. Thank you, Ameil, and thank you for giving the viewers an in-depth reason as to why an online platform for reporting hate is being discussed, being developed, being informed by community members, and addressing to the needs of community members. So we have everybody here on the panel. That's great. We didn't think we were going to finish HCCI business that early, but we finished early, and we are right on time. We're beginning at 7:12, 7:15. So that's really good. So tonight we are joined by Sarah Jama, the Executive Director of the Disability Justice Network of Ontario, and Dr. Ameil Joseph, a professor at the School of Social Work, McMaster. And we're joined, we have Terri Bedminister, who is the Executive Director at Refuge Newcomer Health. And we also have Joanna Frketich from the Hamilton Spectator, and Joanna has been reporting on all things health in Hamilton for about two decades, right? Am I right? Yeah, for about 2 decades. So today we wanted to talk about COVID and community responses to COVID here in Hamilton. And I think to start this discussion, there has to be um the realization that DJNO caremongering kind of embodied the the community response to COVID when we didn't know what was happening, we didn't know what to do, we didn't know who to call. So, Sarah, can you start us off and talk to us about why caremongering and what did caremongering do? Because I just told the public that you were able to connect with over 10,000 families as before when the pandemic started, and even continue to connect with those families.
Sorry, there's a lot of noise in the background here. Thanks for having me on, Kojo. Yeah, at the start of the pandemic, I think my friends and I got together to be like, well, a lot of people can't actually get into the grocery stores. and food insecurity is already an issue, how can we make sure that disabled people who are immunocompromised have access to food in a situation where there's a virus where people could get sick and die? And so we started off in HCCI's office with a bunch of donations coming in for food so that we could distribute it and deliver it. We started off with a Facebook group of like 7,000 people, but then we quickly realized that we were worried about like worsening the transmission rates by random people donating food. So we built a larger system in-house in collaboration with Eric's Cupboard and a few other organizations who helped us figure out like a donation and sorting system. And through that process, we were able to feed thousands of people during the start of the pandemic. A lot of us were volunteering our time, putting over 40 hours a week into it. And then as the system grew, we were able to like develop a phone system. But very quickly, what caremongering had shown was that there was an inability from of our public officials to respond to public health crises in a way that centers the needs of disabled people. So rather than listening to us and supporting us, they asked us to use our volunteer base to drive people to isolation centers. Like we got a call from the city of Hamilton asking us, like a group of disabled people, some of who are immunocompromised, to drive people to isolation centers when we were already just trying to volunteer our time to figure out how to feed people, right? And so there were so many gaps that were showing their heads, and caremongering morphed into Roots to Justice under the leadership of Rowan Mohammed, where it's now kind of developed into supporting Black and racialized people in Hamilton and disabled people specifically. I can't talk too much about that and sort of the change, but what I can say is that disabled people were woefully ignored during the course of the pandemic, and that's why feeding that amount of people was very important. I would also say that another example of disabled people being left behind in the pandemic was that time period for a couple months where we were literally banned from taking the public bus, the HSR, unless you had a personal support worker with you, like your own paid personal support worker or a friend, but usually a personal support worker, especially if you were isolating. So that means without help or a helper, many of us who normally take the bus on our own weren't allowed to. Uh, yeah, that's kind of what is on the top of my mind for right now.
Yeah, and Sarah, thanks for setting the stage, because I don't think people knew the work that was being done to address, as you mentioned, food insecurity, and also, the realization that our municipal government couldn't respond to a public health crisis in a systematic way that addressed the needs of marginalized, vulnerable, and even the general public at large, right? So thanks for setting the stage. So Sarah sets the stage as, we there's a pandemic. People are volunteering their time to make sure that other people have the food they need, supplies, what and all the other things that they need. Ameil, let me bring you in and say, while Sarah and others are doing that, there was also the request or the questions around who is being infected, and how are those individuals going to be cared for, and how is our city going to make sure that we keep people safe. So I bring you in here to say, you did some prior work. How do you respond to, those questions, and the city's response, or even the province's response?
Yeah, I think early on there were reports, out of the states, out of elsewhere, uh, where data on demographics and social determinants was kind of being collected. Race-based data was in some areas as well, and people were well aware of disparities uh, and inequities in terms of infection. And here, and in Ontario, so Hamilton and in Ontario, there seemed to be a bit of a lack of attention to the same kinds of inequities. And it was, through some of the work to advocate for that data collection and then our involvement with the Vaccine Readiness Network, where those demands were tabled time and time again, meeting after meeting, beginning in November. And it was, you two, Sarah and Kojo, who raised, specific asks. Can we have data on who is getting infected with COVID-19 and where? Could we have that mapped? Could we have that mapped in such a way that we can identify neighborhoods beyond the kinds of prioritized postal codes or FSAs that the provinces outlined? And that turned into a situation where we had, some 47% of cases in Hamilton impacting Black and other racialized folks. And it was from that data that it was community leaders, community agencies, community organizations that demanded action, and for those groups to be prioritized for vaccination. And when that didn't occur, close to 6 weeks went by, and that same collective put that history in writing, that we raised issues, that we raised them again, that we raised specific asks around collection, and we had you identify neighborhoods and maps. We saw that it was affecting the most vulnerable. We saw that it was landing disproportionately on Black and other racialized folks in Hamilton specifically, and in neighborhoods, it's very specific neighborhoods, a lot of low-income neighborhoods, a lot of downtown neighborhoods that have been historically omitted from considerations in terms of public health. So severed relationships that go back a long ways. And when we went public with a letter that was signed with over 500 by over 500 people, that's when there was some agreement that some action would be taken to prioritize that particular population for vaccination, and that collective grew. You all, HCCI and DJNO, agreed to help with the bookings and doing the outreach to the hardest to reach groups and allied organizations like Refuge, like the Centre de Santé Communautaire, Hamilton Urban Core Community Health Center, the CHCs that already serve those groups well, and that do the kind of complicated outreach and the trust building that needs to happen because of the mistrust of the provincial and municipal systems that haven't shown that they cared about racialized folks or people with disabilities in general, much less as well as in this specific circumstance. And then we had poof, the Restoration House Clinic. We were told at the time that about 55,000 or so people fall into that category of Black or other racialized adults who are eligible for vaccination. And we know that through this small group of advocates and initiatives, you've served already something like over 6,000 folks. Imagine that, a group of people who run small organizations that are underfunded, who do all of this work to draw attention to the fact that, you have a huge population of Black and other racialized folks and people with disabilities being ignored during the pandemic in terms of prioritization for vaccination. And the end result is that group carries a huge load in terms of that response. Over 10% of that population being vaccinated through your work, through that advocacy. It highlighted a lot of known problems in public health and at the municipal level, and the way we think about health equity or in inequity at the provincial level.
Yeah, thanks, Ameil. And so, here um you have people working together to address gaps. You have organizations talking about a collective way of finding out who is getting infected, how to address those issues. So now let me transition to Joanna. We're having some issues getting Terri back, so we're addressing it because we need Terri in this conversation. So we're trying to address it. But while I figured that out, we figure it out. Joanna, oh, here we go. Terry's back. Thank you. Okay, so let's transition now to Joanna. So COVID hits, everybody doesn't know what's going on. You have caremongering, you have Dr. Emil Joseph and others saying we need to keep track of all this stuff that's going on. What's the as a public health or health reporter, you know where what were the stories that were being told then? Can you, yeah, speak to that?
The stories that were being told at the beginning of the pandemic.
Yes.
So, well, at the beginning of the pandemic, it was really just about trying to get as much information out to people as possible because we didn't know anything really about COVID. So, at the very beginning, you're just trying to keep up with the information. I mean, the stories would literally change as fast as I would write them. You would get that's how fast the pandemic was moving at that time and how fast the information changed. So, you're just I was endlessly writing. I would write a story, and then as soon as it was finished, I would be updating the story. But then, as you move to a point where people sort of understood more about the pandemic, and you're less in sort of that urgent, have to get the basics out, then you're able to start looking at some of the gaps that you're seeing, some of the issues that we're seeing. You're able to start looking at what groups are being left out of vaccination. Why is Hamilton so behind when it comes to vaccination rates? Look at some of how social determinants of health are affecting who is getting infected and who is getting vaccinated and things like that. I mean, nothing I think was more stark than the school by school vaccination rates. I've been a health reporter a long time, and it's very rare that you see a list that is that clear, that showed very clearly the impact that the social determinants of health are having on this pandemic and the inequities in the pandemic. So I think as the pandemic, whenever there is new information, obviously that's a priority to get that out quickly to people. And, we still have to keep an eye on that. But more and more, we're transitioning to working at trying to, see where the gaps are, see who is being affected the most, what more needs to be done, what we need to learn from this, where we still need to go. Those are the types of stories that we've sort of been transitioning to now to, try and raise some awareness about that and raise some discussion about that and maybe see some change come about.
And Terry, are you with us? Please be with
I'm
us.
here now. I'm here now.
Okay.
So sorry about
Okay.
the technical difficulties, but I can hear the discussion and it's really great. So just let me know when you're ready and I'm happy to jump in.
Yeah, you're jumping in right now. We're gonna ask you to jump in right now. So, you know, what when COVID started, as a Emil mentioned that you're a community health clinic center. How did COVID impact the work that Refuge was doing prior to the pandemic?
Yeah, so I think it's, the work of the pandemic is the work, right? And so Refuge, as you know, we focus on new immigrant and refugee health. That's the focus of our work. And so we're a transition clinic, which means that we don't keep clients for a long period of time. The idea is that we do the heavy lifting and then we connect them to mainstream healthcare. In and of itself is an issue, but that is our mandate. And so when the pandemic hit, all we needed to do was pivot. But it's important to really acknowledge that perhaps without your advocacy and the work you may have done before, Ameil and Kojo, Sarah, a number of you would have done to advocate for a clinic for racialized and Black folks, we may have been doing something very differently. We may have been focusing only on our clients and providing access. And I think it's important to acknowledge that. And so while we have been leading the work with the vaccine clinic, which we had to do with you, it's really important to.
Did we lose? Did we lose Terry? Oh no, this is not good. Okay, Terry, can you hear us? No. Okay. We'll try and get we'll try and get Terry back in. So Terry mentioned the vaccine clinic. Um and Joanna, you mentioned the vaccine rates. I believe is you're referencing the story about the St. Anne's, right? St. Anne's in Ancaster and St. Anne's downtown. Is was that the am I right in assuming that was the story you were referencing?
Yeah, it's one of them. We looked at school by school vaccination rates, and it showed that schools in the most affluent parts of Hamilton had the highest vaccination rates, and schools in parts of Hamilton with the most issues when it comes to social determinants of health had the lowest vaccination rates. It was quite a stark list.
Hmm. So then I'll throw this to Ameil and then to Sarah. You know, so how do we address these issues? I know you use the term interventions. How do we get to intervene so that this does not continue happening? Because it seems to Code Red told us that we didn't do anything, right? A pandemic hits, we are shouting for collection of data, nobody does it. We say it's going to mirror some of the health inequities, nobody does anything. Now vaccination rates in schools mirror those things. Nobody does anything. So, how do we intervene? How do we get these things changed without speaking about it all the time?
The reason we're having these issues of disabled people, Black people, racialized people being left out of so many conversations that are life and death is because we're having this is a conversation about whose life matters in so-called Canada, right? It's no accident that most of the deaths around COVID-19 happened in long-term care homes where disabled people, some of the most marginalized members of our communities, were dying en masse. And some of those, like 90% of the long-term care homes in Quebec are public, right? Public institutions. So it's not a matter of like nationalizing certain supports, which is where the conversation stops. But like we have to understand that, a failed healthcare system is a profitable healthcare system. A failed healthcare system is one where, disabled people who are not able to work anymore still have to pay tons of money into long-term care systems, have to pay tons of money into our own healthcare, have to pay tons of money into our own assistive devices, and have to struggle to prove like that we deserve the right to live. We live in a society where it's okay in a public health crisis to ban a whole entire like population segment of the population from using public transport. Like this is really a conversation about who has the right to exist in Hamilton and who has the right to exist across this country. And it does tie back to the fact that like we were even having outbreaks in our shelter systems, and instead of addressing that, what we saw over and over again is tents being torn down, right? People being forced back into shelter systems, and then our shelter systems getting full, and then people being back outside, and then forced back into broken shelter systems, and risking being sick and risking death. This is really a conversation about like human rights, and we're not talking about it at that level. What we have like around these bureaucratic tables, what we saw during the useless vaccination network meetings that I participated in for about 5 months before I quit because I got tired of talking about nothing. What we saw over and over again was us bringing real concerns based on our lived experience, but also based on like what we know to be true, that Hamilton has the largest density of disabled people in the province of Ontario per capita, that we know that Black and racialized people are making up our ICUs, and yet there was still a failure there was a leadership failure, and it didn't come from Like, the failure tax didn't come from a lack of knowledge. Like Ameil said earlier, one of the very first things I said in one of the very first meetings were, hey, I know this data is possible to access because I've done a lot of election work. Can we please pull up like the census data on where racialized and disabled people live, and prioritize those areas with the highest rates of COVID in the city. And we saw a complete level of ignorance and arrogance in these conversations where healthcare professionals with degrees who have no sort of understanding of equity and diversity kept talking to us like we didn't know what we were talking about. And then what happened? There were outbreaks in buildings. And then what happened? People were forced to isolate in their buildings without being able to access food. And then who had to go into the buildings? Black and racialized people, to fix those problems over and over again. We're asked to go knock doors to give people education around COVID-19. My friends and I actually went to, we had to drop flyers. We had to translate the flyers by ourselves. This isn't our job. And the city keeps failing because it's not because they don't, it's not because they can't listen, it's because they don't think they have to. And people will continue to die because of these leadership failures, this arrogance. The last thing I'll say is, when we were bringing up these concerns, the Vaccine Network people, one of them privately emailed, and I don't work for Kojo, so I'm going to say this, privately emailed Kojo to say that I should be fired because of my concerns, because of the things that I was bringing up. They privately emailed asking for me to be fired. This is public health in Hamilton, right? Simply because I said, hey, we need to make sure disabled people, Black people are safe and given the vaccine. That hesitancy is a myth. Sorry, Kojo. I had to say it because, I haven't said it yet.
Yes. No, you're in your own right to say it. So, yeah, we're talking about community responses to COVID, and I think that happened. So you're right. You're right to say it. Yes, Ameil. Uh, how do we address this continuous issue?
Yeah, it's a, a different kind of telling of the history of what's happening now that needs to be told, because otherwise what we'll get is other people or the same people in these situations where they are gaslit, omitted, erased, and then their work, their labor is relied upon to respond to their errors that come out of gross incompetence, and then that credit isn't given to those who carry the load, that do the work, that do most of the work, and that do it well. I think there is, like Sarah said, a well versed group of leaders with the capacity to respond to the most marginalized in Hamilton, that think about these issues in complex ways every day because they're responding to those needs every day. And then there are people who call the shots, who very often are ill-equipped to respond to these very particular needs. And in situations where we have a pandemic that's mostly affecting those marginalized groups, there should have been moments where those who had those knowledge gaps, who didn't have those analyses around what we do for the most marginalized, how we think about equity, and how we recognize existing inequities in healthcare as systemic and historical. In that moment, it should have been, hey, we don't know how to do this. How can you help us? Here's how we're going to resource you to do so. Instead of, let's take our shot at this, even though you're telling us what to do differently, not listen to you, mess it up, have outbreaks in high-rise buildings without prioritizing those high-rise buildings until some 6-7 weeks later. Those kinds of incidents were happening repeatedly. You have migrant workers who are racialized, who are also newcomers and immigrants, who will likely be in congregate settings, where those congregate settings weren't considered in the ways they were prioritizing congregate settings in the beginning of the pandemic. We weren't prioritizing low-income neighborhoods, people with disabilities, racialized folks who are more likely to be uh, HSWs or PSWs, work in um, long-term care homes. Those who are providing support to those most in need as well are also racialized groups who are also frontline workers who weren't prioritized because they weren't doctors and nurses in the same kind of way early on. What I mean by prioritized is they were prioritized as workers, but we weren't thinking about who in terms of identity and how we were prioritizing them. I raise all this to say that when you tell the story for what it's worth, what you hear is community leaders and organizations, those who belong to and serve the most marginalized communities that we're talking about, having the analysis, sharing the analysis, being right about it, responding to crises that were made crises that didn't have to be there. And when that story doesn't get told, we leave the situation intact to reoccur. There have been calls to restructure the Hamilton Board of Health to have a different kind of composition that isn't just city councilors, where you have people that know what they're talking about at the table. There have been calls to change the way we think about what we know. The data collection conversation wasn't just about what we don't know, it's what we can wield from what we already do know. And so you can listen to us. So it's mandated somewhere that has to be done. And there's accountabilities for not doing so. Those are the kinds of things that we could build out of this going forward. Resourcing folks like you that know how to do this well, because we know those are the most vulnerable populations to be impacted, rather than the kinds of funds that are distributed in municipal interventions or in primary care that will fail amongst the most marginalized.
Thanks, Ameil. Um, let me switch to Joanna, and then I'll pass it over to our chair to ask a question. So, Joanna, and this is just a plain question. Do you think the media, or no, I shouldn't say the media. Do you think the spec covered this story around community respect? And yeah, was this story covered in the way that has been told, in terms of the frustration and the realities and the lack of responding to the things that were happening?
Well, I think parts of that story have been told. We have, started to tell some of that story, but I mean, I think there's a lot more that can be done, and a lot more that needs to be done. I mean, COVID has been literally an avalanche of stories. It's been very difficult to keep up with, and the Spectator has put a lot of resources into covering COVID as best as we can. But I think there is a lot more that we can do, and especially some of the investigative work, some of the work that looks at what haven't we done well, where are the gaps. That is work that we're really turning to now, and I think that this, that this is a story that will continue to be told, and will continue to be told, and that hopefully we can do more of as the pandemic goes on.
Thanks, Joanna. And Crystal, I think you had a question.
Yeah, thank you, Kojo. I had a question for the general group, and anyone can take the question. I want to know, what is the thought around what the risk is for the destroying of encampments. I witnessed encampments around the city, and I've had discussions with people who are taking space that I believe belongs to them in their city, and then have that destroyed by the police, by city council, by whomever. What are the risks beyond just re-beautifying the park? What are the real risks in terms of COVID, and in terms of mental health, and in terms of well-being for those who are losing what is essentially their home?
Yeah, there's a lot of risk. Well, number one is when I was arrested at Beasley Park, like one of the encampment residents there was actually, because I was observing the teardown there, one of the encampment residents was actually told to pack up and move into the woods, into the escarpment. Again, and this is something that has been happening over the course of the pandemic. The risk is that they're isolated from their community. A lot of encampment residents support and protect each other. So, like, if someone goes for a walk, like they'll watch each other's stuff. They usually are in like certain pockets of communities that they already know each other. So and usually they're already identified by like service providers. So folks who are at JC Beamer, they pick that park because the bathrooms are open all day, right? It makes it easier to be sanitary. Like tearing people's stuff down when the shelters are full only continues to like further expose people to COVID, makes them throw their stuff in the garbage. You're only allowed like one bag when you go from your tent to a hotel or a shelter. And usually people have accumulated like their whole lives in those tents, right? Of course, over the course of like being homeless for months or years, some people have been like freshly evicted and moved into a park. So of course you're gonna have your life's worth of belongings, and then they're told to make a decision with a 2-hour notice now, because they only get 2-hour notice, whereas before with the encampment protocol you had a 14-day notice. Now it's 2 hours. So you have to make your decision in 2 hours with what you want thrown out or not, or else it gets thrown out for you, and then make the choice about going indoors for a couple days. Talal, who was kicked out of Beamer after the fire, he's back outside, right? Because they sent him to a crisis center, the Barrett Center. He wasn't in crisis, but for 5 days, and so that expired on Monday. And so he's back outside because there's no shelter options. That was the option that was given to him. So the risk is people risk being criminalized, harmed by police if they're trespassing the bylaw protocol for simply just existing outside. And you get further and further more isolated from supports and community members who provide supports, or doctors who know where you are when you're being told to go hide in the woods because you're out of the way. Like, how do you access any services? How do you access support? How does a housing worker know where to find you if you keep being moved from park to park every few days, right? And so this isn't fixing the issue, and it's actually not even making the issue disappear. Like, there's more attention on this because of the city of Hamilton and the police's violent approach to encampments.
Thank you so much, Sarah. Does anyone else have some perspective on that? Because I think it's just deplorable, as you know, that you cannot be a bystander, as Sarah experienced, or a support person to people in the encampment. I think that's a story that needs to be told. You can't expect people to be in the woods and then also removed from the woods. And there's also very other dangers: peril, cold, frostbite, coyotes. There's a number of things that are a danger inside and outside of the city, for people in encampments, but also for people who are being ripped out of them. And so I'm just very concerned about this, and I think it's not helping the cause of COVID at all. I think it's a guise to just protect elitism, and to keep our parks looking a particular way so that people can feel better about themselves. And those people are not the people who are organizing and caremongering for the community.
Yeah, that's an important question. I don't know if Ameil or Joanna, Terry, Terry, we've lost Terry. Oh no.
I can hear
Um,
you well, Kojo.
oh, okay, we
So I
can hear you
can.
now. We can hear you
Yes.
now. Okay,
Yes. Thank
Terry.
Go
you.
for it, Terry.
Okay,
I'd love to hear what you think.
About encampment. I think when you connect it to health, right, we tend to think of health as a medical, we tend to have a medical perspective about health. And so if we are displacing, right, if we're removing, if we're uprooting, there's that health and well-being aspect that is not usually considered. And so while I'm not the expert around this particular issue, you can't help but connect how unwell the process is, how unwell folks will be, and how unwell our community will be. It doesn't take an expert to know that. And so it is discouraging and disheartening to see what's happening now, particularly during a pandemic. Um, and many of us feel that we can't do enough. And so our roles too, we have to look at the roles that we can play as community members to support folks who are doing the day-to-day work, the on the ground work. And we just have to kind of step up. It's not okay anymore to just like the COVID response, to wait for things to happen and to wait for systems to make things happen. I really do like the approach and just the hunger and community to do something and to be part of the response and the solution. And so, I mean, again, not that I'm the expert here, I'm the expert on, how good we can run that vaccine clinic to ensure that, Black, racialized, and folks with other barriers can access, a basic thing like vaccines. But while we do that, the rest of our community is suffering, and it's important to pause and recognize that as well. So yeah, I feel the same way you do. My approaches are not always the same as everyone else's. And so that's what makes community beautiful, is that, there will be people on the ground, but there will be people in the back trying to build and reunite and garner the support to get some more work done. And so kudos as always to Sarah and the group and Kojo and those guys for leading the charge in this work.
Thanks, Terry. So, Terry, we needed you to discuss vaccines. So now that your audio is working, we gotta talk vaccines
Yeah.
before yeah, I don't want any more trouble. So can you just tell us, why it was important to have restoration vaccine clinic, and what are the lessons there for all of us?
Yeah, so data. I mean, it just makes sense, right? We have the data, and it's not just to have the data and to talk about the data and not respond to the data. I just see, again, a very simplistic view on a huge issue, which is if we know that a particular population or segment of our population is impacted by a particular thing, there's enough of us around the table to get things done. Yes, we look to our elected officials, our leaders, to step up and lead that. But when that doesn't happen in the way that works for communities, it is important for us to raise our hands and say we got it. And in this particular case, it happened. It's we knew what the data was saying. We knew that we had to respond, and so we spent a little more time waiting for things to happen, and in so doing, a lot of frustrations, a lot of upset, more advocacy than should have even been, because this is not something we should really been advocating for. It should have been something that should have been part of how work is done to respond to need. And so while it's great that we advocated, we have to look at why we had to advocate. That's a core problem. That is a huge issue. And so a number of us remain, even after the vaccine clinic, we're advocating to be at tables to repeat the same things we would have said about equity many months ago. And is it frustrating? Absolutely. Is it necessary? It's sad, it is, but we have to continue, and we have to empower our communities to also have that voice and to advocate. And that's where I think, with the little bit that we do as one of the partners, actually, there are a number of great partners at the table. You think of individuals like Ameil, yes, and also agencies, HCCI, DGNO, Urban Core. I hope I don't forget anyone. Compass, the Francophone Center, and kudos to the family health team and McMaster family health team as well too, for supporting some of the back end admin work. That's important to say. These agencies are together to offer vaccines. It just seems like, why should we have to do that? And why shouldn't everybody be doing that? Why shouldn't we have had the conversations that said this is necessary? That said, the optimist that I am, I think we've really we've built on some relationships there to support future decision making around access to vaccines and important any other important thing in the community. And I say the vaccine clinic is really a representation of hard work. When you look at those who access the clinic, we don't like to say they were hesitant. Yes, there was some hesitancy, but what we also saw that there were some competing priorities. You will only see that if you know your communities, and you'll only know your communities if you show up. And so in the vaccine clinic, we're seeing that. Folks are not saying, "Oh, I don't always believe in the vaccine." They were saying, "I had other things to do." But if we had closed that door and we labeled everyone as hesitant, we would have lost quite a number of folks in the process. And so that's probably the lesson learned for us, is to ensure that meet communities where they are, understand that within one community there are many other communities, and the best way to do that is to use folks who are part of those communities to reach them. Seems very simple, and so I'm sharing that from a very simplistic standpoint, that we have to be at the table. Representation matters so that we can have really good impact on these health issues to communities who need them most.
Yeah, yeah, and thanks, Terry. This is what you are saying is definitely true, and yeah, I think this is a great way to publicly say thank you to Refuge for running restoration clinic, and for doing the work that's needed to get people vaccinated. So a big thank you to Terry and the folks at Refuge. So we have a couple of minutes. I know there are a couple of people that have been putting in some comments. If you have any questions, those that are watching, if you have any questions, this is the time to put it in, because we are almost close to getting finishing our community discussion here. There's I think Alicia Weingart is saying, moving people from park to park, tearing down encampments is a way of pushing gentrification here in Hamilton. So these are things that are also happening. Um, we have let me okay, we have a question from Karen Balcom. Is anyone creating a history and archive of the story behind community activism and COVID in Hamilton, apart from this amazing session? Well, let me answer this, and I'll pass it to the others. It's tough because we're asked to we're doing the actual work, right? Reaching out to people, sending out people, doing canvassing to get the word out around the vaccine. So if Karen, if you have some hookups or people that that can do that archive for us, we're more than happy to connect with them. I don't know if anybody wants to say anything before I ask the last question.
Yeah, I think
Sorry,
like
go
we're all
ahead.
tired. Other people should be attempting to document what's going on. I would like to retire from this line of whatever I'm doing. So if anyone else who's watching stuff wants to be able to just write stuff down and document, that would be a huge help. Because we don't, I don't have. This is not fun. Like, yeah, that's all.
Mhm.
Yeah, the grace come in early, eh, Sarah? The thing is, Joanne, I hate to do this, but I'm looking squarely at you. I see you have the pen in your hand, and I would love to see even some smaller stories in the archives of the Hamilton Spec about what people like, what we've talked about tonight. I mean, I'm really glad that you were guest on tonight, and I really hope that we can see more of that, because that allyship is really important, and that coverage is incredible and necessary, so that we don't have to keep repeating the same problems again and again, right? Well, absolutely. I mean, I think there's a lot of stories to be told here. I mean, the Spectator has done some work on these stories. Tevi Amoro does some incredible work in this area. He did a beautiful story on doctors, going right into encampments and taking vaccine to people with wagons and backpacks. It was a beautiful story that was very well read, and I think really brings things home to people. And we've done our best to try and tell some of these stories, but obviously there's still a lot more to do, and that is something that is definitely on our radar, and we can always do better. And I think that that's something that the Spectator is definitely trying to do and will keep trying to do.
Yeah, so thanks Joanna and Crystal. I just wanted to put this one, we have a comment, and this one goes to Terry. So J Move says, I really appreciated having a pop-up vaccine opportunity at JCB. Air felt like option. So there you go, Terry. You were running all the vaccine pop-ups in the park, and I believe the JC Beamer pop-up was the one where there was music and people were dancing and everything. So that's big shout outs to Refuge. So l- last question. Oh, did Terry, did you want to respond?
No, I said that's an awesome comment. That's great.
Ah.
We love open air and dancing. I
Good,
love it.
good. Good. So, my last question to all the panelists. You know, I'd like to end on, somewhat of a action, or, on a inspiring note. What are the lessons that we take from this, and what are the next steps for people that are watching, and for, maybe your respective organization, or something that you think HCCI should be thinking about? So why don't we start with Joanna?
Well, I would say that one of the major issues we've had during this pandemic has been quality information and consistent information. Data has been a major source of frustration during this pandemic, and it's also very inconsistent. I mean, those school by school vaccination rates were so important and showed major gaps, showed places where there needs to be some emphasis, there needs to be some advocacy, some change, but not every community has those. Almost no other community has those school by school vaccination rates. And there has been inconsistent reporting on workplace outbreaks. Hamilton reports on them, other places don't report on workplace outbreaks. And then there is inconsistencies on things that Hamilton doesn't report, but other communities report. For example, Hamilton doesn't report on people who died with COVID, where COVID was not an underlying cause of their death. Where Haldeman Norfolk, it has a separate category for that. So these types of things, when you don't have consistent data, it is very difficult to identify those gaps, and it's very difficult to start those discussions. So I think it's really important. That's something that at the Spectator, we're really working to try and get that data, try and make sense of that data, and try and find those gaps to report on some of these stories that you're talking about here, especially stories that reveal issues with social determinants of health. I mean, that is a very well established barrier to healthcare, and something that we need to explore a lot more and do a lot more work on.
Thanks, Joanna. Terry?
I almost feel like Joanna spoke for me, because because just that, I think when we have the data, we have to respond, and when we don't have the data, we have to go look for it so we can respond, right? And that's the premise of how we've undertaken our work. We've really followed the data, and where there isn't, then when we do get it, we have to do something about it. So it's again seems very, very simple, and then it leaves you to wonder, then why aren't we doing those things? Why aren't the folks who are in those positions, just as Sarah said earlier, these are highly educated, high functioning folks who should just know better. But the opportunity with that is, communities, mobilizing communities to not necessarily always hold people to account, but to step in and do something. It's not okay anymore to sit back and wait for those to do and to act. And that's what I would like to leave with whomever is viewing right now, that within all of us, there's just, if there's that will, you can get it done. Sometimes, as we see, there are folks who pay a higher price to doing that. But I think let's empower each other to get on the wagon and help each other to get these things addressed in the community. So yeah, that's what I'd like to say. We will continue as an agency, although very under resourced, to do as much as we can and to collaborate with others to get the work done around vaccines or any other measure or intervention to support our community. So I can definitely say we'll be doing that.
Okay, thank you, Terry. And Terry, you didn't tell folks what's happening on Saturday.
I couldn't hear you at the time. So what's happening on Saturday? There is a clinic, and it'll be the first that we will open up to peds, to our 5+. So we've booked just about 30 little ones, just so we can have enough time to make sure we do this well. We'll have a very welcoming environment for them. And so if there's anyone who would like to get their child vaccinated, we ask that you call the office just so that we're preparing for you. Our phone number is 905-526-0000. But this week we're full. So please call us about next Saturday. So we run the clinics every Saturday for the last little bit. We've been operating, Kojo, since April, May, June, something like that, through a booked system. But from September to date, it's been open to everyone who has been experiencing barriers to access, okay? So yes, this Saturday we'll be at the public library from 12 to 3. It's still a walk-in process for adults, so you can show up there. But for the children, would really like you to call ahead so we are ready and prepared for you.
Okay, thank you, thank you. And next up, we have Dr. Ameil Joseph.
Uh, you guys were talking about a lot there. I think there are some folks who've been working for some time to catalog some of this history, and some of that work will happen kind of going forward. And I know there's some agencies that collaborated on some grants to do some of that as well, but also to kind of wield this knowledge, this kind of strategic capital that you've built to continue the work in the ways that you support one another. It's inspiring, and I think it's unique. I think the way that some of these agencies and organizations and that serve the hardest to reach groups are thinking very carefully about how to save people's lives. They're staring death in the face really quite starkly every day. That mutual aid work, the caremongering work, is bringing life-saving aid to people. The work to establish the vaccine clinic is literally saving lives. I received emails from folks that said, because of the clinic, I was able to go myself and bring my family and convince my aunts and uncles to go. Like, all of that stuff is unheard and unsaid generally. And some of us see it because we're really close to it. And those stories won't be lost. I promise you that. I think what we can do is recognize some of this work in a way that doesn't leave these organizations and leaders struggling to do the work on their own, and recognizes the kind of backlash that comes when you call out systemic racism, when you call out the fact that the project of evicting homeless people from encampments or houseless people from encampments is a death-dealing project. And when you call that out, it comes with some backlash. Sometimes that turns into hate mail. Sometimes when we started the clinic, we were peppered with racist backlash. And just the other day, after the Black leaders organized to speak out about the police brutality against those who were trying to support those who were being evicted from encampments, also received hate messages, like terrible, terrible stuff. The ways we stand up for each other, I think, could get better. But I think we all have a part to play in that.
Thank you, Dr. Joseph. We finish with Sarah. Is Sarah still there? Yes.
Yeah, sorry. I was eating rice, so I turned my camera off. I think the only thing I would add and remind people is that mutual aid is a politic that was developed specifically by disabled people who have had histories of being left out of what it means to receive care, right? Like, our communities have always been able to provide for ourselves and care for ourselves, and it's also a very African politic, right? That we take care of each other, we keep us safe, and so anybody can participate in mutual aid. You don't need to be part of an organization. You can make the decision today to go check out an encampment, provide food, get to build relationships and people in your communities, because that's all it is that we are trying to do. If all of us are doing it, like, we're impossible to shut down. What we're asking you to do is redefine who has the right to be cared for in our communities. We all do, but not all of us have the privilege of being cared for. Not all of us have families. Not all of us have homes. And so, like, really dig deep into yourself and think to yourself, what is it that I can do today to really support people who don't have the same privileges that I do in my community? Our government consistently reminds us that disabled people are worth less, that Black and racialized people are worth less. Social assistance rates have been frozen for decades, for almost as long as I've been on this planet. They've been frozen below a poverty line, right? People deserve the right to exist and to live freely and equally, but despite their ability to hold a job, despite what their disabilities are, despite what they're going through, we all deserve the right to exist. And to practice that, to show that, is a politics of love, is a politics of care, and we need to be supporting each other. So it's not on the Black people in HCCI or any of these organizations to continue to do the work, because us doing this work to vaccinate you all, to feed you all, is Black people who also have limited resources trying to care for all of you in Hamilton. So the responsibility is also on you to start filling these gaps and to work with us and support us in community. Like, I'm looking for you, or to you, for leadership as well, for anybody watching this.
Thank you, Sarah. A politics of love and a politics of care. I think that's something that we all.
Oh, he's gonna make fun of me later, guys, but
No, no, I'm not. It's serious. No, no. So, yes, a politic of love and care. That's what we're going to aspire to. So, a big thank you to all our panelists on the community discussion: Terri Bedminister, Joanna Frketich, Dr. Ameil Joseph, and Sarah of the Disability Justice Network of Ontario. And thank you to everyone that tuned in. Again, we'll make sure that our annual report is up on our website. You can check it out. We had the link posted earlier on. That way, folks can read it. So you are up to date on all the things that we've been working on. And again, if you want to support this work, I highly encourage you think about becoming a monthly donor. There's also a GoFundMe account that has been set up to support the youth that were arrested last week. That's something that you can donate to. If you are also in support and want to be part of the Hamilton Encampment Support Network, you can also send some donations their way. They needed info at hesn.ca. So those are the financial ways in which you can support. And as Sarah said, you can try and build community where you are, and let's continue with that politics of love and care. So I think that's it. Thank you all for watching, and we'll see you next year at our AGM. We always do our AGMs in November slash early December. So we'll see you next year in 2022. Thank you all.